Hello there, my name is Kayla Parsons. I will be giving the negative rebuttal and closing speech. First off, thank you, Cynthia, for your compelling arguments in support of universal health care. While the moral appeal of universal coverage is powerful, I must emphasize that the practical consequences of such a system would be deeply problematic for the United States. The affirmative side made a compelling case for healthcare equity, citing poor health outcomes and the moral need for reform. However, the affirmative side did not fully address concerns around innovation slowdown, implementation cost, and unintended consequences of federal control. According to the Congressional Budget Office, from 2022, implementing a single-payer system could cost an additional $32 trillion over a decade. Such a cost would demand massive tax increases. These increases could disproportionately impact working and middle-class families. Moreover, countries with universal systems like Canada and the UK experience major access issues. In Canada, patients wait a median of 25.5 weeks for treatment, according to Fraser Institute from 2022. The UK's National Health Services currently has a significant backlog with over 7 million people on waiting lists for treatment, and that number continues to grow. This is not a model to be emulated, especially when considering that the backlog is significantly higher than official figures suggest due to hidden waiting lists. The NHS is facing considerable challenges, including delays in accessing care, long wait times, and a lack of resources. Let's not forget the innovation and quality at stake. The United States is responsible for more than half of all new pharmaceutical drugs globally. Stifling private sector innovation with sweeping regulation could slow progress for the patients worldwide. Rather than abandoning our current system, we should pursue targeted reforms, such as expanding Medicaid, enhancing Affordable Care Act, which are financial assistance programs designed to help individuals and families afford health insurance, and offering public options that increase access without overhauling the entire infrastructure. Ladies and gentlemen, here is why the negative side wins this round. We have shown that while the goal of universal care is noble, the path proposed is fiscally irresponsible, administratively inefficient, and dangerous to innovation and choice. Even if we agree that healthcare is a human right, it does not follow that a single-payer federal system is the best way to guarantee that right. Focus the debate on the most important argument. Access does not equal quality. A government-run system may expand coverage on paper, but this will only create long wait times, limited provider options, and reduced care quality. Defending only what we need to win, our case represents real reform through incremental, sustainable changes that protect innovation, preserve choice, and expand coverage through improved policies. Judges, you should vote negative because our side offers a more realistic, economically responsible, and flexible solution. One that expands access without sacrificing innovation, patient freedom, or quality of care. We don't need to dismantle the entire system to make meaningful progress. We need smart, targeted reforms that actually work. Vote negative. Thank you.